So this is a machine that's been purchased by the Kusuma Trust and Prostate Cancer together. This machine is revolutionary. This machine, basically, it used to take a couple of days to grow a culture to determine what it was that a patient had. And that's the way that it's been done historically. This machine can identify what it is that a patient has within seconds.
The MALDI-tof analyzer is a mass spectrometer, so it'll look at the protein signature of bacteria and fungi very quickly, within seconds, and give us an identification of that organism, which in clinical terms means that we can get the patient on the appropriate treatment sooner in their patient episode. We will use this machine on a daily basis. You know, we have relied in microbiology on a variety of techniques. Some of the techniques that we have relied on are still, believe it or not, over 100 years old microscopic techniques, but these are being supplanted by novel state-of-the-art techniques which now harness the power of analysing proteins, analysing DNA, and this is one of those analysers that will take over from some of the pre-existing techniques to give us that new repertoire.
We will be able to save lives, basically, and therefore, you know, we are very proud and very gratified to see that already 2 patients who have been critically ill have been saved as a result of having this machine and equipment available, which has given very prompt results.
It's much, much better for the patient because you're not started on numerous different treatments. It's also better for the functioning of the hospital because obviously we know exactly what the patient has, what the patient needs. And it's better for the turnaround of the beds as well because it means that the patient will need to be less time in hospital because we've identified what was wrong with that patient much, much quicker.
When you're choosing an antibiotic for a patient, you often choose initially a best guess antibiotic based on what the patient's symptoms are and what the likely organisms are. And it's the lab tests that follow on blood or urine or sputum which then tell us with certainty what the organism causing the infection is and what antibiotics will work against them. So the MALDI-tof is one of the tools that we will deploy in the lab to help in our battle against antibiotic resistance as well.